Good afternoon. Welcome to Linn County Public Health COVID-19 media briefing for March 18th, 2021. My name is Caitlin Emmerich, and I'm a Public Information Officer for Linn County Public Health. I would like to introduce Heather Metter, our Clinical Services Branch Supervisor at Linn County Public Health. Heather will provide an update on COVID-19 response and vaccination efforts, and then will be available for questions after prepared remarks. Heather, go ahead.
Good afternoon. Yesterday, Governor Reynolds announced the state of Iowa anticipates expanding COVID-19 vaccine eligibility to all Iowans by April 5th, 2021. This anticipated change is due to the expected increase in supply of vaccine in the coming weeks. In Linn County, we have seen our weekly allocation increase slightly and expect to see an increase in the coming weeks. With the anticipated expansion of eligibility, local efforts for vaccine allocation will not change significantly. We will continue to allocate vaccine to local healthcare providers, pharmacies, and offer targeted vaccine clinics. At this time, vaccine is still limited. We encourage you to accept whatever vaccine type is offered to you when you become eligible. All 3 vaccines are safe and effective. We know many people are waiting for the Johnson & Johnson vaccine. However, at this time, we do not know when or how much will arrive in our community. It is the hope of Linn County Public Health that when the vaccine arrives, we will have the ability to offer this 1-dose vaccine to vulnerable populations, which may be hard to reach, may be more transient, or have barriers to accessing care. Vaccine providers are making progress in vaccinating our community. In Linn County, of the 36,000 adults age 65 and older, about 73% have started or completed their vaccine series. Additionally, about 30% of adults in Linn County have started or completed their vaccination series. While this is great progress, we still have a ways to go before every person is able to get a vaccine that wants one. With about 180,000 individuals age 18 and older in Linn County, not everyone will be able to receive a vaccine as soon as they become eligible. Information on how and where to schedule an appointment for eligible populations can be found on our website at linncounty.org/vaccine. Or you may call our COVID-19 call center at 319-892-6097. As our supply increases, the supply of vaccine will likely catch up with demand. As this happens, we encourage all adults to get vaccinated to keep you and your family safe. This will help our community return to normal and to further reopen the economy. We understand that some of you may have concerns regarding the speed at which the vaccine was developed. We want to reassure you that scientists and health professionals in the medical community are confident in the vaccine safety and effectiveness. Studies and trials for the COVID vaccines being used in the United States have been reviewed by the FDA and the Safety Board with the CDC. The vaccine may cause reactions like a headache, body aches, or a mild fever. These reactions usually do not last more than 1 to 2 days and are a sign that your body is building immunity to prepare to fight an infection if you are exposed. The vaccine is a safe way to build immunity. Becoming infected with COVID may lead to pneumonia or other complications, resulting in hospitalization. It is not possible to predict how your body will respond to the disease. Yesterday, the Iowa Department of Public Health announced that 38 additional cases of the COVID-19 variant strain B117 or the UK variant have been identified in Iowa. This is an indication that this strain is circulating within the state, much like across the US. Based on epidemiologic and modeling data, researchers believe that the B117 strain can be spread more easily than the original virus, which causes COVID-19. Researchers believe that the current COVID-19 vaccines will likely protect against the B117 variant, and additional studies are ongoing. Therefore, it is critical for Iowans to get the vaccine when one is made available to them. Reaching herd immunity will be important in slowing virus transmission. With the news of varying strains spreading within the US and in Iowa, it is important to continue to follow measures to prevent the spread of COVID-19, including wearing a mask, practicing social distancing, washing hands, staying home if you feel sick, getting tested, and getting a vaccine when you are eligible. It remains important to follow these recommendations until a vaccine is readily available for everyone who wants it. This week marks the 1-year anniversary of Linn County's first laboratory confirmed case of COVID-19. This anniversary may cause feelings of grief, loss, or other emotions. These responses are normal reactions in reflecting on the past year. As we reflect, it is important to know that there is reason for hope. Safe and effective vaccines that will help end the pandemic and save lives are being administered as quickly as the supply allows. The many sacrifices we have made, although difficult, have made a difference. While there is reason for hope, we know many of us still struggle from the losses and challenges of the past year. As we continue to push forward through these challenges, using support systems, both formal and informal, as well as checking in on those you care about, these will be valuable as we focus on mental wellness in the coming months. Assess your needs and match them with self-care strategies that have helped you in the past. If you need to seek professional help, recognize this is just another self-care strategy. You are resilient. Links to mental health resources can be found on the Linn County Public Health website at linncounty.org/health. Linn County Public Health will provide updated information on COVID-19 at linncounty.org/COVID-19, through COVID-19 status updates, and on Facebook and Twitter. For up-to-date information on COVID-19, sign up to receive our COVID-19 status updates by using the Notify Me tool on the Linn County website at www.linncounty.org and selecting COVID-19 status update under the Newsflash category. Thank you.
Thank you, Heather. We do have time for a few questions, and I see that there is one in the queue here from Michaela Ram of the Gazette.
Yeah.
So Michaela, go ahead.
Hi, thanks for taking our questions today. Heather, you said that Linn County saw a slight increase in vaccine allocation and is expected to see a further increase. What are those totals, if you don't mind sharing?
Sure. So with our next allocation, we are receiving 4,810 doses of vaccine. We don't know what we will be receiving after that, but like many of you would have seen yesterday on the governor's press conference, it sounds like more should be coming. We have not received that additional information yet, but we are happy with a slight increase.
Okay, absolutely. I have a couple more questions, if I may. With this new announcement coming April 5th, do you know, are the providers that you're working with to vaccinate residents, are they going to continue prioritizing certain groups, or are you otherwise asking individuals who are less at risk to maybe wait for vaccine if they can?
So if you are eligible for a vaccine, we want you to be vaccinated. We don't want people to feel guilty about getting vaccinated when they are eligible. Again, reaching herd immunity not only protects yourself, but protects the community. So if you are eligible for a vaccine, please go ahead and get one. Providers have been working hard to get people vaccinated. As I stated earlier, about 73% of those 65 and older have been vaccinated, and we want to continue to vaccinate that group. We also want to continue to vaccinate those that have disabilities and underlying health conditions. But anyone that is able to receive a vaccine whenever your time comes up, we don't want you to wait. We want you to get vaccinated.
Okay, and then just to follow up and clarify, healthcare providers reaching out to their patients, are they still kind of picking those maybe with chronic underlying conditions or anything like that, or?
I'm not sure how the providers are doing it. Every provider is going to be a little bit different. Some providers have already moved through their populations of 65 and older. They have moved through some of their populations with underlying health conditions. So every provider office may be a little bit different with where they are in that process. Some providers are just probably getting so many phone calls that it's hard for them to do that. So every office is going to be a little bit different with that. But some providers are still trying to prioritize, and many are just trying to get people in and get them vaccinated.
Okay, thank you.
Are there any other questions for Heather at this time? I don't see any requests in our queue. Okay, well, I am not seeing none, so I think that we'll go ahead and conclude our update for today. Thank you so much for joining us for these important updates regarding COVID-19. Again, we do encourage everyone to visit our website at linncounty.org/COVID-19 to continue to receive information. You can also receive information through our social media channels on Facebook and Twitter. And then as a reminder to our community, please continue to wear your mask, social distance, and be patient as we work to vaccinate our community. We are nearly there. Thank you for hanging with us this past year. Thank you.
Thank you.